Dr. Poonam Alaigh is our medical expert. She is here now to discuss a growing epidemic as our population ages, Alzheimer's disease. Welcome to the show.
Thank you, Laura.
We came off a package about dementia, Alzheimer's. What's the difference?
Well, dementia, Laura, is really the symptomatology. So it's a lot of different things can cause dementia. So it's sort of a congregation of symptoms where you have memory loss, language barriers, your personality changes, you have behavioral issues. Things like that happen, and there are lots of causes of it. But Alzheimer's disease is really the leading cause. About 50 to 80% of dementia is caused by Alzheimer's disease.
And it's really difficult to identify. My grandmother had Alzheimer's, and they weren't able to confirm until after her death when they could actually run tests on the brain.
Yeah, truly. The confirmation happens only at the time of death. And that's when you do the biopsy and you see those typical beta amyloid proteins in the brain. However, it is a disease of exclusion. History is very, very critical. Usually the onset of symptoms happen at the age of 60. Between 65 and 74 years old, we have 5% of our population with Alzheimer's. But really the startling statistics is that by 2050, our population in terms of having Alzheimer's disease is going to grow exponentially. And that's really what the concern is around Alzheimer's.
All right, so can you treat it?
That's a really good question. You can, the Alzheimer's disease happens when there is destruction of the brain cells, and it's progressive and irreversible. So there is no treatment that prevents that. There's no treatment that cures it. However, there are things you can do in order to maintain your mental health and boost your brain power.
Can you give me some examples of what you can do? I heard doing crossword puzzles is a great way, just simply staying active. Give me some examples.
You know what the bottom line is? Whatever you do for your heart also works for your brain. So that's sort of the one-liner. So whatever you're doing in order to maintain your heart health also works for your brain health. So one of the biggest things is really maintaining your risk factors, your cardiovascular risk factors. If you have diabetes, if you have hypertension, if you have high cholesterol, make sure you're managing that. But after you take care of all that, the important things are, for example, physical health. Exercising regularly is extremely critical. Mental health, to your point, crossword puzzles. Try doing things that engage your mental being. Do things that you've never done before. Learn something new. Connect with people. Try using different senses that you normally don't use in your routine, day-to-day life. Spiritual and emotional health is very important. Make sure that you're socially connected, surrounded by friends and family. That becomes extremely critical. Eating right. I mean, the one thing I really like to talk about is the rainbow diet. So lots of fresh vegetables and fruits. And those
lots of colorful
colorful foods.
This is a topic we could spend an entire hour on, but this has caught the attention of the President of the United States. Tell me about the national move to address this growing concern.
That's actually very important. This year the President actually signed into law something called NAPA, or the National Alzheimer's Project Act. It appropriates funding of about $150 million specifically to fight Alzheimer's disease. The goal is to develop a national Alzheimer's plan with goals by 2025 to come up with tangible solutions to prevent and cure disease, to do research that's integrated, to have lots of different partners come together, to have international bodies come. One of the key elements is providing support to both the patient and caregivers, because as we're looking at research and improving our understanding of disease, which is, again, has a lot of research has been done around that, the most important thing is to maintain our patients in the best mental and physical health while the disease continues to progress.
Education is key because the caregiver has to really understand to be able to help the patient. Dr. Poonam Alaigh, thank you so much for being here with us.
Thanks, Laura.